Lovely evening to every single one of us who's joined. Thank you so much for making the time to join this webinar. I know guys are busy, but thank you for making the time. Hopefully, it will be helpful to each and every one of us, especially the people who are looking to understand a bit more about endometriosis. But welcome. I'm Lydia Waheto. I'm a photographer by profession. I run SBA Studios, but I also run Wotoria, which seeks to raise awareness on endometriosis. I'm also an endo warrior. I was diagnosed with endometriosis in 2023. Yeah, so it had been an incredibly long journey to diagnosis, but we got there, and my life changed for the better after diagnosis, knowing how to deal with what I was going through, what I'd been diagnosed with, which is endometriosis. So, yeah, welcome to this session. I'll briefly talk about this project called Echoes of Hope. If you hadn't joined us for our previous webinar, you probably may not know what Echoes of Hope is. Um, so, Echoes of Hope is a multidisciplinary project using dance and photography, basically using creativity to create awareness for endometriosis. So yeah, since I'm creative and our partners, Victoria's partners who are low state of mind are also creatives. They use dance to raise awareness on mental health issues. We thought we'd use whatever tools we had in hand to just create awareness about what endometriosis is and drive positive change for endo patients. So, with that said, I want to keep it brief before introducing our incredible facilitator, Elsie. I'll just quickly introduce Suleiman, who is one of the founders of Low State of Mind, to just explain briefly what Low State of Mind does and how they are contributing to the Echoes of Hope project. Karibu.
Thank you. Thank you very much, Lydia. Hello, everyone. My name is Suleiman Maningi, one of the co-founders of Lost State of Mind. In Lost State of Mind, we normally use dance and arts to be able to create awareness on mental health and also other society issues that people don't usually like talk about it. So we try to use our creative, mostly dance, to be able to just to speak the language like most people cannot be able to converse, but at the same time pass the message and also create awareness. And we're very happy to be able to do this project very close to us. And we are hoping to raise awareness and also give hope to the people. Thank you very much, Lydia.
Okay. Thanks, Sule. You've kept it brief, so asante sana. And now, without taking more time, I'll introduce Elsie, who will introduce our lovely panelists, and we'll get to learn more together. Karibu, Elsie.
Thank you very much, Lydia, for the opportunity. I'm really excited to be here today. I know if there are any Kenyans who are online, I know that a large part of the audience is Kenyan. I know we are all excited about the long weekend. Woohoo! Can we see some reactions to the long weekend? December is here. And I hope that you are all looking forward to closing the year and hopefully getting some rest. It's been a difficult year. Speaking on my behalf, on myself. I'm not speaking for others. I will let others speak for themselves. So for me, it's an incredible opportunity. I think following our first webinar, and I'm really truly honored to be working with Lydia and the Echoes of Hope community as the Endometriosis Foundation. So just to introduce myself, I'm Elsie Wandera, and I'm the founder of the Endometriosis Foundation of Kenya, and also the co-chair of the World Endometriosis Organizations. And so that was the one exciting thing that happened for me this year. So I know Lydia, we didn't discuss this. This was not part of our prep, but I'd love for people to share what's the one thing that happened to you this year that you're really, really, really proud of, like from an achievement perspective, like whether it's your work, whatever that looks like. Please share in the chat, and we will celebrate with you. So I'd like to introduce the panelists, and my role here really is just to guide the conversation, right? So the last time we met, we were talking, our first webinar was where we talked about coping with endometriosis as hidden burden and the health cost, right? And so we took your feedback, we listened to you, and many of you told us you wanted more practical guidance, and you want hope because these diseases are really, really difficult to navigate. And so we thought about, how about we do a follow-up session that just really helps you get some tools from the experts, the professionals who are in that space. And so that brings us, I guess, to this session today. So today we're continuing. The journey is healing, and we want to keep the energy of hope, right? And so we want to make sure that women are focusing on, again, regaining control of their lives, because again, this disease just always feels like you're not in control, right? So the first person I will introduce is Lydia Mathu. She's an office administrator in the Ministry of Education based out of Nyeri. So we really celebrate you, Lydia, for joining, and she'll tell us a little bit more about herself. She's the first person who's going to be talking, and then I will hand over, I'll bring the two the two medical professionals to guide us as we discuss the technical bits around the disease. So the next person I would like to introduce is also going to be on the panel, my dear friend and partner on this journey, Faith Kishanga. She'll talk a little bit about herself. Faith, I don't even want to introduce you because I don't think I will do justice. And so I'd love to give you that opportunity later on. And then, of course, the person who gave us, a lot of us who are on this call, hope and light, and we really felt seen, Dr. Charles Muteshi. He's the assistant professor of reproductive medicine and surgery at the Aga Khan University Hospital. But in brief, we just call him an endometriosis and fertility expert, just so that you have reference to who he is and what he does. So I'll start with Lydia, just so that let's get the patient's perspective. Let's get a lived experience perspective so that it sets the stage, so that even as Faith and Charles come on, we are going to be able to have like a reference point for us to have a more detailed discussion. So Lydia, I am officially inviting you to the stage. Karibu.
Asante sana. Thank you so much for having me. My name is Lydia Mathur. Madam Elsie introduced me. I work with the Ministry of Education in Nyeri as an office administrator. And I am an adeno warrior. I was diagnosed with adenomyosis in the year 2020. And I am on a journey. And it all started. There was a series of misdiagnoses at first, because in 2015 I experienced an ectopic pregnancy, and I went for surgery. And then in 2016 again, I had a miscarriage. And then after the miscarriage, that is when I started experiencing some of the symptoms, but I associated them with the miscarriage. I didn't know there was something behind it. And in 2017, again, I tried conceiving, which I did, and under doctor's watch, I got my baby at 36 weeks through CS. And then after the CS, a few months after the CS, I started now experiencing the full-blown symptoms of adenomyosis, heavy flows, a lot of pain, fatigue, which again I associated with the CS, and then and pelvic pain as well, and it would be managed by um, pain medication. And then in 2019, I felt my tummy became boggy. It was enlarged, and now I sought the advice of a physician who, after an ultrasound scan, he thought that it was a hernia. It showed that I had a hernia. But then again, looking at it, he recommended me for another one, which showed that I had an ovarian cyst. And I was referred to a gynecologist. And when the gynecologist looked at it, he thought, no, this is not an ovarian cyst. He said he would like to go with me for the scan and see it for himself. And what he saw said looked like endometriosis. And because I was in a lot of pain, heavy flows, and my tummy was enlarged, he took me in for a laparoscopic surgery. But when he got in, apparently he found a tumor uh, outside the uterus. He called subcutaneous, somewhere subcutaneous, just under the CS scar. And had now to be cut open, and the tumor was removed and it was taken for biopsy. It revealed that I had a desmoid tumor. The tumor was a desmoid tumor, not malignant, but chances of recurrence are very high, and when it recurs, it's very aggressive. So he recommended that we, after some time, because now the symptoms were still there, the symptoms I had before were still there, he recommended that I go for an MRI. And it is the MRI that revealed that what was really not being seen was adenomyosis. And now we started managing adenomyosis. At first, I was put on contraceptive pills, and then and for some time I was relieved, especially for the flow and for the pain. I was put on oral pain meds, which would work for some time until a point where the pain meds would not work, and now I had to go for the intravenous jabs for pain, and that is what I am on right now. But I have had a series of surgeries before, and when the doctor again told me that the ultimate cure would be, the removal of the uterus, at that point I was not in a state of mind where I could handle another surgery, because it would be the fifth one in my life, same place. And so he told me to watch and listen to my body, and not to assume any symptom, especially the pain and the flow. And then when I'm ready, I could go for the removal of the uterus. But at that time, I was not in a state of mind, in a proper state of mind. And then had some, in 2017, I lost my parents. At the same time, on the same day actually, and that is one thing that affected my mental health as well. So I didn't feel like I was ready for anything about adenomyosis other than just seeing my doctor, having my pain meds, and keeping it to myself until recently that I was able to talk about it and to accept it as to accept myself as I am. And I felt at that point, I felt now I am in control of my thinking. I could listen to my body, and I'm in control of my life now. And that is why I'm here to talk about my experience.
Thank you so much for sharing, Lydia. And my God, even in the briefing, I don't think you had shared about the loss of your parents. And so more grace to you. We extend you like our sincere and most heartfelt condolences. That could not have been easy. And just for the rest of the audience, I think the reason why we brought and we are profiling someone with adenomyosis is because often these conditions are similar in the way they present, the symptoms, and both of them are often misunderstood. And as you've heard from Lydia, there were times when she was being misdiagnosed, and that's also similar to what women who have been diagnosed with endometriosis, that's most of their experiences. So just for you guys just to understand why, again, we're bringing adenomyosis, because also it is likely that people who have been diagnosed with endometriosis have a likely chance of also having adenomyosis, and we feel like it's not talked about enough, but we call them sister conditions, and therefore I think it's important for us to bring the connection together, because the pain, the physical pain and the emotional pain, I think both of them carry kind of the same burden and the same weight. And it's really a gray area that we're still trying to figure out how do we navigate. Lydia, tell me, I know that getting the diagnosis, right? When your doctor told you it was adenomyosis, first, I mean, you're kind of like, you're walking in the dark and you're trying to ask yourself, so what is this? He does tests, you go for all these several tests and procedures just to get like an understanding of what the heavy bleeding is all about, etc. Trying to just get a sense of what you're suffering with. How did it feel like, and how did that then translate to how what your journey, I guess, working with your family, I mean, for me, I'm excited that, it's a Ministry of Education. So I'm like, you must be an educator at heart. What did that then mean for you, for your family, for your workplace, and even for your community? Talk to us a little bit about that.
At first, when I got the diagnosis, and mind you, I had just received my desmoid tumor diagnosis at the same time. So it was quite a hard time for me. But I am so glad that my family, I don't know how I can describe my brother and my sisters, because even at the time when I was going for the surgery, it is my brother who used to drive. He could not even understand. He's the one who used to drive me to hospital when my sister was not available. And also my nephew and my nephew would also drive me to hospital, and my niece would stay by my side all this time. She would be the one to help me with everything that I needed at the time. And despite the fact that we would Google and try to understand this thing, it didn't really sink in. And I was in denial. And my doctor, I had a very good doctor who would really take his time to explain to me what it is and how to cope. But at the time, I cannot even, I just remember the doctor assuring me, reassuring me. But whatever he told me at the time, I cannot remember. But I just remember the way the time that he took with me. And then for my family, my sister would go and research about it. And she's the one who used to tell me more about it. So my family has been very, very supportive. And even now, if I am in pain, if I call any of them, they will come for me wherever I am and rush me either home or to the hospital, and which I'm very grateful. And then at the time, in 2020, I was working with the Department of Defense, and I had a very good boss. The boss didn't even know what I was suffering from, and he just told me to go take my time. I remember his words. He told me, just keep your phone open, just in case we need to talk to you, but take your time, get well, and then you come back to work. But unfortunately, I could not explain, even to my closest colleagues, what I was suffering from. Anytime I would try to explain maybe what I'm feeling, because people would try to get me solutions that I don't subscribe to. And that department was very, very supportive. But even up to now, they didn't know what I was suffering from, but they really, really supported me. My friends, I think I told just one friend. My other close friend learned about it just the other day. But I was able to explain to her what it was the other day. And then at that time, I was in a relationship that went down at that time. My relationship went down at the time, and I knew as for the relationship, I have been on this journey on my own, but with my family by my side and that friend by my side. And then, unfortunately, okay, let me say this friend of mine who made me go to the hospital. Unfortunately, she passed on last month, but she had cancer. And then when I kept telling her what I'm feeling, what I'm experiencing, and then she told me she had just had her first round of chemo. And she told me, I'm better than you. I know what I'm suffering from, but you don't. And that is the point where I decided, now let me go to the hospital. And immediately I came from the hospital. Immediately I got my results uploaded. She's the first person I called. And she was very supportive up to her last day. And I have had people by my side, and my doctor is a good one as well. And then to go, unfortunately, when for myself, I know I have learned the art of masking at work, especially. So I used that mechanism at work, which I later realized would affect my mental stability in the long run. So I tried to mask, but masking in the long run did not work for me. But everything else that I have had, my family, my friends, my bosses, they have worked for me.
I love that. So tell me, how then did you decide, okay, and I'm so sorry again for those are just too many losses. But I'm just so grateful that you had a friend who was able to tell you the importance of self-advocating, naming the disease, because it is important for us to give a name to this condition so that we know exactly the assistance and we're going to seek out. Tell me how then, because you told me as you know, as we were getting to know each other, that you decided, okay, fine, I've been private with this disease, not anymore. I'm going to social media. In fact, Lydia is on here, and full disclosure, I think on their behalf, they're cousins. And Lydia was shocked that the other Lydia was suffering. She was like, what? So it's very possible that people don't know what you're going through because we are not coming out and we're not talking about what we're really suffering with. And it's as a result of how we've been socialized as women, to take on pain, and to sit with it and to like wear it like a crown. But tell me how you turned that pain into purpose.
That pain, there's a friend of mine
Sorry, Lydia, we've
that
lost.
her daughter were really, really painful. And can you hear me now?
Sorry, Lydia. Yeah, start again. Just start again. Start again. Start
Okay.
again. Take
Okay.
two.
Okay, this friend of mine who told me that her daughter was having very heavy menses and they were painful. And what I told her is that um, that menses pain is not normal, and that she should see a doctor. And she told me, no, 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 I'm just waiting for her to get her firstborn, and this pain will be gone. And we started arguing. That is the point where I realized that since I have an experience and now I have the knowledge, I should not keep it to myself. And I should speak out. Maybe it will help someone out there. We have survived on so many myths and beliefs that are pushing us backward and making us suffer. So I thought maybe if I could just help one person, that would make me really happy. And that is why I decided to, and many others like her who thought that this pain was normal and that getting a child would cure this. And that's why I came out again. Sometimes God lets us go through some of these things so that He can use us for His people. And no, I am. I am
Sorry, we lost you again. It was a little bit
really.
delayed. Yes.
Oh,
Just say that we lost you, and unless it's just me, but we lost you at God uses this pain for.
yeah, He uses us to help others, probably on His as His vessels just to help His people. He uses us for His as vessels for this purpose. So I know He's using me as a vessel for people who are suffering with adenomyosis, and maybe they don't have the diagnosis yet.
Okay, so how has the experience been sharing the stories on social media? I mean, we know how social media is, right? Please tell us a little bit about, I mean, and are you are you brave? Do you feel brave when you share? Like, are you afraid of like the backlash? Sometimes people will tell you things, unsolicited advice, like you said, people telling you, oh, by the way, do this so that, this can happen. How has your experience been as
Uh,
we close your session?
as for the fear, not anymore. The backlash, um,
Yes.
I don't concentrate on the backlash, but
Mm,
what motivates me is when someone comes to my inbox and they're like, please help me with your number. I have this,
nice.
and then we share. Or
Nice.
when someone asks me for the contacts of my doctor or where to get the doctor, it
Mm-hmm.
really that is all that I am after. For the backlash, I don't give it much thought.
I love it. I love it. I love it. Ladies and gentlemen, give it up for Lydia. We We have little time. I wish sometimes I wish like, we had like 60 hours like to have this conversation because we barely scratch the surface. Like now I feel like asking her, UNKDF, a very, like we know it's a defense forces, male dominated. You're expected to show up as strong. How was that? But anyway, I guess maybe you guys need to join us for we've got some news that we will share at the end. So stay on so that you can just hear a little bit about what we've got planned for next year.
Yeah.
So now let
Elsie,
me bring yes,
sorry, could I just quickly share some comments directed to Lydia from the
absolutely,
chat
please. Yes, yes,
section?
yes, please. Oh yes,
So Joyce Adhiambo says, receive lots of hugs, Lydia. So there's a lot of support in the comment section. And
yay.
we have another comment from Nancy Wambura saying, strength and love, Lydia. Thanks for sharing. Mhm. So thank you for sharing your
I
story.
love it.
It takes a lot of courage.
I love it. Mhm.
Thank you. I'm
Absolutely.
humbled.
It does. Karibuni nyote, we can see your comments. Thank you. Like how these platforms are changing. I thought I was chatting everyone, kumbe I was chatting the AI note taker. Ha 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 ha. Laugh at me. All right, so let me bring the two friends. I call them my friends because we've been walking this journey a long while. And even though they're professionals in their own right, I feel like we're friends. Not I feel like, I know we're friends. We have walked this journey together. So the next person, so I'll call the both of you guys to take the stage, Charles and Faith. And I'll just be throwing questions just between the two of you. So just to quickly introduce Charles, I won't read his whole bio, but he practices at the Aga Khan University Hospital, where he's leading, the endometriosis management. I know that he has set up a multidisciplinary team, and it's the first center in Africa that we've also had the privilege of actually writing a paper that has been published just to talk about like what we have been able to do partnering with the patient organization and the medical profession. So I think we'll talk about we might touch on that a little bit, but I don't want it to take the spotlight. And then of course Faith Gishanga. Again, I can speak about Charles because he's straightforward, but I really want Faith to talk about, I want you to talk about your story because the story that I know. So, Charles, I'll start with Faith. Let me allow her to introduce herself and just talk a little bit, just give us a little bit of snippets of your professional journey and then also, your personal journey in this space.
Okay. All right. Thank you, Elsie. Can you guys hear me? Okay, great. So, as I've been introduced, my name is Faith Gishanga. So, today I am here on wearing two hats. So, the first one is the professional one. So, professionally, I'm a counseling psychologist and also an organizational psychologist. So, yeah, and the other hat, the reason why I'm here is also because I'm an endo warrior, and this is a journey that I have walked. So as much as I support people to be mentally healthy who are suffering from this, it's a journey I know too well. So I know what it means. A lot of the things that Lydia has shared, I have walked that journey myself. But also other than that, getting to know Elsie, getting into the advocacy space. This is something we've been doing for a while now. And I'm very, very passionate about just creating awareness as far as endo is concerned, especially the mental health aspect. So let me just summarize it as that, Elsie.
Thanks, Faith, and it's lovely to see you, by the way. Just looking as gorgeous as always.
In the bundus.
And thank you, by the way, because yeah, we know that you've taken the call. We appreciate that you accepted. Charles, are you able to speak? I know that you're traveling as well, like you're on the road. Tick, tick, tick. Charles. Charles, are you there? Okay, cool. So let me just I'll come back. Oh, there you are.
Give me a minute to just arrive, but give me a minute.
No worries. I'll start with Faith. Just ask her just one question. So, Faith, you've heard about Lydia's story. And I think for me, the thing that I know a lot of us women and the stage we're in, like we're at in life, is we spend probably 80% of our time in the workplace, right? And we know that this chronic pain, truly it creates that a lot of emotional fear, so fear of when the next flare is going to come up, fear of the future, not being understood. How can someone start managing this anxiety? And really, I think we have to think about managing the anxiety just gently and just also realistically. But, we're tackling just so many things, but there's at the base of it, I think, my view, and I stand corrected, and that's why we've invited you, is how do we manage that anxiety?
Okay. Let me start with, I know we are endo warriors and adeno warriors, but I feel like Lydia is the warrior of the warriors. The
She
things
absolutely
that,
is.
she just kept adding on to, like something else and something else that has happened as, she's still trying to figure out adeno is quite something. So Lydia, hats off to you. So back to your question, Elsie, about work. It's been a while since I had discussions about endo. So thankfully, I think Elsie, I've shared with you that I've not had the pains in a while now. I got treatment, it's been 6 years. But I think sometimes I forget, and when I'm in this space, I'm reminded how that life used to be, and the opportunities that we even do not go for. Because even before applying for a job, I used to look at it and I'm like, they are requesting for all this number of days for travel. I don't think I can do that. Or they're requesting for all these things, or I have to. There are many things we had to consider. So first of all, that just gives us such a disadvantage. And even when you are stationed at a place where then it's comfortable, it's the office that there's still that. When is the next pain going to be? When is, all those anxieties that you're talking about. So one of the things, and Lydia, she mentioned when she was saying how initially she wasn't talking about it. She, not even her next, one of her good friends did not know. You're saying her own cousin did not know. So one of the things that I feel is very liberating, even in helping us manage in not just at the workplace, but generally everywhere, is what I call acceptance. I think once I just accepted that this is it, and it takes a while because I feel like if I accept, is it a weakness? When I accept, am I giving up when I accept? But no, that's not the definition of acceptance. Acceptance is saying this thing is here. In the next 2 weeks, I could be in pain. So I need to accept, because once you accept is only when you can do something about it, right? So once I accept, then I can even talk to people about it, because now I'm working with reality rather than hoping and fantasizing that that pain won't come, or it won't come when I'm at work, or so I feel like the biggest thing that we could do for ourselves is the acceptance. So when I heard Lydia said, now I even started talking about it, it's that time. It's only once you reach acceptance. So acceptance is not weakness. Acceptance is not giving up. It just means that there's this elephant and it's here. and it's for the time being, it's here, and I need to know how to work around it being here. Okay. So who do I need in my corner? What realistically, I might not go again for the jobs that other people might go, but it doesn't mean I can't go for any other position. So that's what I'd say. I think acceptance is a huge part of, I mean, there are many other things. I can say
Whoopsie.
acceptance is a big. Can you hear me?
Sorry, Faith, we lost you. You were talking the
Oh,
last bit. Acceptance is.
yes. So I was just saying acceptance is not weakness, it's not giving up, it's not anything negative, but more like just saying this thing is here, it's my reality. So I figure out what decisions can I make based on that reality, or two, who can I enlist in my corner based on this reality, rather than hiding it from them, rather than trying to run away from it. Yeah. So I was saying there are many other things, but I can just say acceptance is a big one.
I love that. And I think one of the biggest unspoken burdens of these conditions, adenomyosis, endometriosis, just because of how society has labeled them, right? Like we know immediately, like when someone comes up and says, like we have heard, statements like, immediately you hear someone who's suffering with adenomyosis and endometriosis, it is equal to infertility. It's not the same for everyone. So we're here to bust those myths, right? But loneliness, I think, is the biggest unspoken one, because you're suffering on the inside by yourself because you don't know how to articulate like what you're going through. And I think Lydia mentioned it. She was grappling with, how do I explain to people like what I'm going through? So moments of isolation, the moments of where you're thinking about like, okay, am I being misunderstood? Am I over explaining? Am I oversharing? And that can be it's a very lonely journey. I think the question that I wanted to ask is, how can someone who is going through these conditions and has been diagnosed and knows what they're suffering with, build a sense of connection and support when they feel that isolation and misunderstood and all those questions, shame, etc., all of those things?
Okay. Very good question. And you can see how even that still a little bit goes back to acceptance, because as long as I haven't accepted, I don't know how, maybe I'm carrying the shame, I'm carrying all those things that I'm trying to hide. But once I accept huu ni msalaba wangu, then I walk with it, so that's one. But also, I think when people talk about loneliness, I tell them, let's take that word apart, okay? Because Elsie, when you say you're lonely, and when I say I'm lonely, and when Lydia says she's lonely, we mean different things, right?
Correct.
You always realize that loneliness is a part of what you're missing. It's not necessarily that there's not someone there with you, right? Is it a conversation you'd want to have? Is it someone who could help you do something?
Right.
So once you identify what your loneliness is, because loneliness for different people, even for me at different times, it means different things. So it's also very important for you to recognize what is your loneliness. What is that you're aching and desiring for? Okay. So that also, I find that very helpful. Because again, Elsie, I know there are times you've been alone. I stay in the house sometimes for a whole week and I'm not lonely. There are days I stay for one day and I feel very lonely, right? So it's something, it's just loneliness points to that one thing or two things that you desire someone around you could do. So once you identify, then you can see how to meet that need. Okay. So that's what I'd say. Again, it's over and above even just endo, just generally when you talk about loneliness. Yeah. So I hope that's helpful.
I love that. I think I'll ask you one last question, and I hope that the people who are on here can also just chime in and in the comment section. We are monitoring those. I think I want to ask you one question, and you're in that space, right? There's a lot of misuse. And, people are using terms incorrectly. And especially, we've seen, people are self-diagnosing with Google, with TikTok, etc. You end up mixing up conditions without proper guidance. So you're here telling yourself, because I'm presenting these painful period symptoms, then therefore it equals endometriosis. And that might not be the case, right? And I think the question for me is, how then do we encourage people, right? Instead of relying on the internet versus getting a proper diagnosis, right? Especially for conditions like, endometriosis and adenomyosis, which are still not understood, right? And I'm going to bring on Charles immediately after this to just really talk about the landscape. Tell us, like, just the misuse of terms, like nowadays, like if I feel upset, I'm like, you're triggering me, and I'm like, huh? Should I be triggered by? I mean, is that the right? Am I using the right terms? And especially also with endometriosis, because it's becoming like a trend now. Everyone who's experiencing painful periods, and we're not dismissing, right? We just want to be able. Sorry, before even finishing you answer, please go ahead and answer.
Well, I'll let Charles answer for the physical illness, but I
Correct,
guess it's still the
correct.
same. Now, this is though how I look at it is actually, let me just give an example of yesterday. I thought I had malaria. I was feeling all the symptoms. Okay. Now, so there is having the symptoms and then thinking I have something. Okay. But then I did a test and it turned out negative. Okay. So it's okay to say I have this, I have, I think I could have, but it's only until a test is done, only until you see a professional, then you can qualify. So even as we call people narcissists, even as you say, I have depression, maybe I have one or two, three symptoms that maybe are similar to what when people have depression, they have, but I can't say I have depression. It's only after a diagnosis. Then you can verify. So you can say, yes, I am having symptoms. And I think maybe, probably, it could be this. There are times I have felt malaria symptoms and it's true. And it's just that it was yesterday, it wasn't. So I can't always feel the symptoms and say, yes, I have malaria. I could say I have symptoms similar to, but then I need a professional then to guide and say, this is it. Yeah. And you're correct about all these terms we're using, triggering and gaslighting and all these things. But you know what? A part of me is happy that they are part of our vocabulary. Honestly, it's better that people know how to say endometriosis. But then now we need to also have the correct diagnosis, because then if we use the words and they don't mean what they're supposed to mean, then we don't get the right intervention. And also we may overlook the people who, because then it's the word everyone is using, triggering, then we may overlook the people who actually get triggered and what that means and looks like. Okay. So it's a somewhat positive that people have these words in their vocabulary, but also it's important to just seek professional perspective in all these things. So whether it's physical or psychological illnesses, conditions.
Thank you, Faith. Because we do want to keep probably like maybe 20 minutes of this session just for people to ask questions, and hopefully for Faith, Lydia, and Charles to also respond. I want to bring on Charles right now to just talk about the disease itself. Like really, let's just go into it, right? Charles, karibu sana.
Yeah, thank you, Elsie.
It's good to see you.
Good to see you. Thanks very much.
Yeah. And thank you for taking the time to be with us. We know you're a very busy person. And yeah.
Thanks. Yeah, thank you.
And again, we appreciate your time. Charles, there's this thing of where, like, as a society, we live in a society where a lot of women, I mean, all of us, we've normalized period pain. And therefore, even for a woman to describe her pain as unpredictable, confusing, because of how the symptoms present itself, please help us understand what is really going on inside the body of this woman. If you have adenomyosis or endometriosis, help us understand, just so that people then can understand from a medical practitioners and a clinical perspective, like what is actually happening to me. And oh yes, Charles,
Yeah,
please introduce yourself.
thank you, Elsie, and everyone who is on this call. I think I would stick to what is presented on the slides before us. Assistant professor at Aga Khan University, reproductive medicine subspecialist. I do a fair amount of work in endometriosis and fertility, and my research cuts across understanding how the disease intersects with fertility, but more recently into how it affects the person. And so we're looking at things like quality of life, impacts on work, relations, and coping. So we feel that this contextual approach to endometriosis is able to define a human rather than a medical condition that requires only one way of, we usually call it a biomedical approach. So if you use a biomedical approach, then you see the doctor, they prescribe medications, or is a surgeon who takes you to theater. But that's really not the right approach. So it's very difficult for me, and I always find it's complicated to say what is this disease? How do you define endometriosis? Because one, it involves pain or a condition that is deep-seated in the pelvis, an area that is considered, I may loosely use the word taboo, because we don't always talk about it very openly. And if you tell someone I've got pain in my pelvis and they look at you, they don't want to lock eyes with you. They possibly look aside because it's considered taboo, and that's what we've struggled with for a long time. And it comes along with stigma and things like that. Unfortunately, because it's a condition that may start early, as early as when periods start in young girls, they don't even understand, their bodies, and not everyone is very open to discuss with them, because a passage of knowledge. I was glad that the first speaker, who is in the Ministry of Education, and now the focus has been, let's talk about endometriosis and other conditions at that age. Maybe it will be easier. So in a nutshell, without taking too much time, Elsie, I think when we say endometriosis, to simplify, because if I tell you, it means that tissue or cells that look like the area of the womb that menstruates. Many people may not understand, because you see periods as an outward flow of blood, but they do come from the womb. And the womb is that part of the body that will eventually carry a pregnancy for those who desire, to have a baby. And our bodies are made of, every part of our body has a very specific function. Even your skin has a very specific function. So if you look at yourself as bits and pieces of very specialized organs, then every part of your body is supposed to be doing a particular thing. So the area of the womb that gives menstrual blood, and it's that area that will probably carry a pregnancy if you're pregnant. Some of that is found in other places. And so you would think that if that is supposed to be doing a particular job, a specific function, and then it's sitting in the wrong place, whenever there are changes in the body, for example, during a cycle, it will easily shed away and you have a period. But then if the cells are sat in the wrong place, they will cause tissue breakdown, as we call it, or cells breakdown because they are bleeding or they are inflamed. And any part of your body, even if you use a very small pin prick and just stick it through your body, it causes pain. And so you can imagine on a bigger scale, which is bigger than a pinhead, you've got this inflammation that is going on during your periods, and it's usually, hellfire. So there's a lot of discomfort, a lot of pain, and eventually the cycle carries on over and over every time you have a period, and the tissues will heal, and then they get sticky, and that's what we call medically as scar tissue or adhesions, and then they bring everything together. So you get organs getting, stuck together. But that tie between that physical condition and the symptoms we express is complicated. And so there might be pain, there might be, discomfort, there could be fertility problems. And the perpetuity of this discomfort and pain eventually ends up with psychological distress because you are anxious, you are anticipating a period to come, but you know that when it comes, it could be painful, and it could get you in the wrong place. Like Faith says, you get a new job and you're thinking, oh, I might have a trip. I don't know where I'm gonna be caught by my period, so you don't really want to go. And so once all these things come in, and then it becomes a whirlwind. And medically, when we look at people approaching us with potential symptoms or a diagnosis of endometriosis, then we try to widen the scope of how we want it looked at. So the current approach is endometriosis is a life course, which means that you have to look at the person living through their life and how they navigate through, because you have this condition, it could be managed, it could be controlled, it could be treated, but every stage of your life comes with different expectations and its own challenges. And so you might just want to scale through university as a student, but at the point when you want to have a baby or when you get a job, how do you manage endometriosis? So this is how we approach it. And of course, we have to look at it as multi-pronged. I might say I'm a reproductive medicine surgeon, but it's not just the knife alone that I use to tackle endometriosis.
I love that,
I hope
Charles.
that helps a little.
Yes, it does. And I keep saying, like, we never have enough time to talk about this, but I know, and I've been honored to be a part of the journey with you in terms of even just the publication that was recently published on the model of, the multidisciplinary endometriosis care in low and middle income countries. And, we talked about how, where there are delays, right? Diagnostic delays, we know that we're limited in terms of imaging expertise, the whole shebang, the lack of biomarkers. And I know there are a lot of women who are out there who say, oh my God, why can't you just diagnose endometriosis through like a blood test? There's so many myths, Charles, out there. And we know that a lot of women are sitting with their pain, and studies are out there that show that, it takes on average 7 to 8 years before someone is actually diagnosed with endometriosis. What would you encourage women? Because I think some of the questions that were even coming in, because when we sent out the registration link, we asked people to just ask questions. And some of the questions that we got is like, what am I suffering with? I'm going through this. I'm experiencing these symptoms, etc. And we know that endometriosis symptoms mimic other conditions, right? So in order to shorten that delay, for herself, what could you encourage these women to do?
Yeah, so we live in an ecosystem of a health structure or a health system structure that is probably partly, I would say, functional or partly dysfunctional, in the sense that most of us, don't have access to a primary care doctor. And so a primary care doctor would be that doctor who looks at you at family level, and you could see them whether you have a cough, whether you have a sprain, whether you have a nosebleed, or whether you have a period cramp or pain. But because the structure of healthcare is not well built, then that immediate access to a family care physician is not always available. And in places where this is the case, then these are the people, because they are the frontline healthcare providers, are equipped with information and knowledge to recognize symptoms. Because again, it's I always feel it's unfair to put the burden on the patient to know that they have a condition. It's that's why we go to medical school. It's not your job to try and imagine you are suffering from this or that, because and you cannot only suffer from one condition, so you can specialize as a patient. You can have a headache, you can sprain your ankle, you can have a stomachache. So every time you shouldn't really know that now I think I have a heart attack, now I have this. It is the role of the healthcare system that should look after you. But because we don't have that functioning as effectively as it should, and then we try to engage with the public, disseminate information right from an age that can consume that information. We know, as young as kids who are adolescents do understand. They will know. If you tell them, if you feel this, please realize that it's not necessarily normal. Speak to your school matron, speak to your parent, speak to someone that I feel the following symptoms. And that person has the onus to say, yes, this little girl keeps coming for a pain medication because their stomach hurts. They will not be saying they have periods that are painful, because menstrual flow is not painful. It's actually, you feel your stomach hurts. And if it's repeatedly doing so, then it should be that person to realize, no, I think you need to seek further help. And that further help would be either to a hospital or a doctor with requisite skills and knowledge to make that diagnosis. So that dissemination of information should be at that level. It doesn't matter where you are, and it doesn't matter your literacy level. You should not necessarily be too clever for you to know that I have a problem. It should be at a level that someone knows this is not normal and I need help. They don't need to be able to pronounce the word endometriosis to go to hospital and think that they have a problem.
Right. Oh my God, yeah. When these people start talking, like I'm excited. I'm just like, okay, I want to add. But again, this session is not for me. We've created this space for everyone to just add in their comments, and we can see the comments that are coming through. I can recognize the time. I think we have approximately 20 minutes before we close. I think for me, what I would love to do here is, if there are any comments or any questions, maybe if anyone wants, Lydia, can I hand over to you? Maybe there's a question that probably Charles or Faith could answer. I think one of the ones that I've seen is from Wamboy Fidelis, and she asked about, I'm learning quite a lot, and I'm wondering if there's such platforms for PCOS. Absolutely. And I said absolutely. And I have volunteered. It's interesting. I was at APHRC today, where we were actually they were actually presenting a study on infertility. So there's so many things that these conditions then introduce, and one of them is infertility. And so I was there again speaking on behalf of Endo Warriors, and we talked with the founder of the PCOS Foundation, and even the Waiting Wombs founder, who's an advocate on just helping women who are navigating the journey of infertility, just to bring community people together so that then we can help them navigate this journey. And the one thing that we committed is to bring ourselves together. So one of the things that we're committing is in the next session, we will have the three of us, the founder of Waiting Wombs, the founder of the PCOS Foundation, and then the Endometriosis Foundation, to just come and talk about like these conditions, which are so similar and causing women the same challenges. So before I ask another question, maybe Lydia, there's one question from the registration that we can address before I ask them one last question and invite the audience to even bring on cameras.
Okay.
So that we see the faces of the people who are here.
Okay.
Are they? Yeah.
Okay, so just quickly before I ask the question, just a big thank you to the panelists who just shared a lot of information that hopefully everyone finds very, very helpful in their own journey. So thank you so much for making the time to just show up. So guys shared a few questions beforehand. So I think I'll combine some of them. We can start with the pain one from Jackie. The question is, if you've had painful periods all your life, does it mean that perimenopause and menopause will be difficult? Are there natural ways to manage the pain? And just to try another pain question is from Lillian. What are the categories of pain management medication that one can use to manage pain when they get bouts of pain, that is? So yeah. So one question addresses having painful periods all your life and how it affects menopause and perimenopause, and the other one is about pain management medication. Recommendations.
So I think I'll start with Charles. Let Charles answer that because I feel like that's his forte, and then I'll close with a question to Lydia and Faith.
Yes, so I think the pain in itself has to be investigated, or you need to have a diagnosis of the cause of pain, because pain is a symptom. Pain is not a diagnosis. So, and there are many conditions that can cause pain, and so even when you have pain that is chronic and affecting you, throughout your life, we will always want to understand what is the cause of this pain. And pelvic pain, for that matter, for instance, could be because of conditions that are related to gynecological disease, or they could be something as different as low back pain because of a prolapsed disc that is being compressed. And so the effect of the menopause on pain can be variable, and it all depends on what condition you are dealing with. And now, of course, a lot of old literature or studies used to say that if you have endometriosis or pain that affects your reproductive years, you're likely to get better or cured if you get into the menopause. And part of that is the reason why we invented medications that can mimic or induce menopause. But we do know that menopause is also a very respectable stage of life that comes with its own expectations and its own management, which can stretch from simple lifestyle adjustments to medications or hormone replacements. So in the context of something like hormone replacement, that has to be taken very carefully, because when you're using hormones that potentially may have an impact on the behavior of conditions like endometriosis, then you cannot assume or tell anyone that, oh yeah, when you get into menopause, your pain will completely disappear. And so I think it's always good to understand, one, pain is a symptom, and it should always have a diagnosis. And once you have a diagnosis, then we know how it's gonna transition as time passes. What pain medications? I think from a public health perspective, we will always advise that you have access to what you may call first aid pain medications. And first aid pain medications are paracetamol, brufen, the ones you can buy over the counter. You can't have stronger painkillers without a prescription.
Right.
And secondly, it's also important to notice or recognize that we categorize pain as acute and chronic. Acute pain are pain symptoms that come suddenly due to something that has caused tissue injury or potential tissue injury that may recover or leave very little discomfort later. And that responds very well to common pain medications. But when it comes to chronic pain is completely a different thing, and it does not always respond to medicines we use for acute pain. So if you take anti-inflammatories or paracetamol, or even stronger medications like tramadol or even morphine, those medicines work pretty well for acute pain, but they are not designed to work for chronic pain. And a lot of girls will say, I keep taking medicine. After 2 hours, the pain is back. After 1 hour, the pain is back. After 30 minutes, the pain is not going away, because you're using medications that are designed for acute pain to try and manage chronic pain. So always remember that, and go back to your doctor and say, okay, my pain is categorized as chronic. What are the appropriate medications that can use in addition to other modalities of managing, so you don't use the wrong medications for the wrong condition? I hope that helps a bit.
Perfectly answered, Charles. And I think that's what we like to encourage, the Telegram group that we have, a peer support group for women, girls, and even the partners, people who are living with endometriosis, just so that, again, and Charles is in there, so he usually answers any questions that the girls have. But again, we don't want to encourage you to always go to hospital, not to hospital, but to like a pharmacy or a chemist to try and get like over-the-counter medication, because we also don't know what we are doing to our own bodies, even as we take all that medication. I'm recognizing time. Faith, I have one question. Boundaries. How does someone set boundaries without feeling guilty or misunderstood?
So I like to put that under the category of self-care. So self-care, I think just how we've been socialized, it's every time I think about myself or something that benefits me, it's something negative or selfish. So I usually just like to distinguish the difference between self-care and selfish, right? Selfish is when you are, like, so I'm taking something for myself at the expense of the other person, okay? But self-care just taking care of me. If now for self-care, the other person might get disadvantaged, but not because I took the thing away from them. It's nothing I took away from them. It's just that I put a fence. So think about like having a fence, right? So when you build a very good house and have like a let's say an electric fence, okay? So when you're putting up that fence, is it to protect yourself or to punish the thief? Okay. It's never to punish the thief. We hope no thief ever comes. We don't know if a thief, we don't even know who that thief is. So when you think about boundaries, think about it that way. So we can't say, I build my house and put this fence to disadvantage a thief. Okay. So that's the difference. Boundaries are supposed to be things that protect ourselves. It protects me. Okay. So that's how you know you're putting a healthy boundary. Okay. So when you find yourself, you're threatening someone, that's not a boundary, or it's an ultimatum, that's not a boundary. Okay. But because then that is something that you will do to the other person, you will disadvantage, but something that protects you. Okay. So let me give a quick example. It's got nothing to do with endo, just a simple one. So for example, you have this person every time they're on phone call with you, maybe they shout. If you're having an argument, they shout. Okay. They shout, or they use very, words that are not kind. Okay. So it's okay to say, I'm okay to have this difficult conversation with you, but if you keep raising your voice, or if you keep shouting, or whatever it is that the person is doing, I will no longer be wanting to be part of this, and I will disconnect the phone. Okay. So you see, I'm not doing that to disadvantage them. I'm okay to have this conversation. What I'm trying to do is protect myself. Okay. So that applies in all other areas when you think about boundaries. So that way you shouldn't feel guilty. I shouldn't feel guilty for disconnecting a phone call because I didn't want someone shouting in my ear. Okay. So that's how to have healthy boundaries. Now, take that to whatever situation that is. If it's at work, if it's with friends, if it's with family members, how then can you start forming healthy boundaries? Because then it depends on the situation, whatever it is. If it's at work, you have this colleague who passes over their work to you all the time. And because you're trying to be nice and play ball, you always just end up overworking. We know one of the symptoms of endo is fatigue, right? So you're here, breaking your back, and just because you don't want the person to look bad, or just whatever it is, okay? So you saying that you will not continue doing that work, and they end up getting in trouble, that's not on you. That's the thief who I put an electric fence but decided to jump anyway. They got electrified or whatever it is. That's not on me, that's on them. Okay. So that's how I'd put it, Elsie.
I love it. I think I'm going to remain with that. And that's how I think you're helping us retain the information and the knowledge just by sharing those nice, interesting analogies. So thank you. One question to Lydia and to Charles, right? So Faith has told us one answer. And to Charles and then to Lydia. Lydia, you can answer this. So what's your last message, I think, Charles, as these women and ladies and the girls and the people who are coming for a doctor's visit? What would you encourage them to come and share and talk to you about?
I think I would want to first of all say that there isn't any one shoe fits all kind of approach, but every person is unique in their way. But if they feel they need to contact the healthcare system in any way, usually there are two scenarios. One is you are in an acute medical crisis, which means that maybe you have a lot of pain, which seems to be the predominant symptom of endometriosis, and this may bring you to accident and emergency. It's always useful to seek compassion, have your pain managed, but don't make important decisions about what can be done if you are in an acute medical crisis. Wait for that to pass and then come back to the hospital and meet the doctors, perhaps when the pain has lessened or you've taken medications that have improved that pain. Come with someone who you trust, can also listen in with you and discuss what it means, what the diagnosis is, and what are the options available for you going forward. As I said, look at endometriosis, adenomyosis as a life course. It is not one moment that you want to fix something and you've got a lot of pain and telling your doctor then, do everything you want to do. I just want this pain gone. Of course, do everything to make you comfortable in the acute crisis, but don't make important decisions during that acute crisis. I think that's all I can say.
Thank you, Charles. Yeah, don't transfer money when you're in pain. Or don't say yes to that man when you're in pain. Don't accept a date. Yeah, and so we have to take, I think we have to approach these conditions through a life course lens. Thank you, Charles. Lydia, and then I will say one last thing after Lydia finishes. What's the one thing you will share with the ladies and gentlemen who are on this call? Lydia Matthew.
Oh, I was almost asking which of the ladies. My word is just to love ourselves as we are. One thing I didn't like about my body was my tummy. Yes, it's big, and I didn't like about it. But then I realized that's me. There's nothing I can do about it, and all I can do is to love it and talk about it, and and we just love ourselves as we are, and be happy. And of course, when the time comes for us to seek medical advice, we do so. It's very important.
Thank you. Thank you, Lydia. Faith, I know I may have asked you about the boundary, but one last point, one last thing.
Sorry, can I interject, Faith? Sorry,
Yes.
as you're sharing your last point, there's a question in the comment section. I know we are running out of time, but Martha, asked about how endo affects personality or personalities, how she used to be very consistent in checking up on her friends, but of late she struggles with even checking up on them. So how endo affects our personality and anything we could do to probably deal with that.
Okay. For sure, endo consumes us. It's our relationships, it's our work, it's everything. I wouldn't say necessarily it affects your personality. However, it can change your behavior. Okay. So for example, we said you can be more isolated. So for example, you have this condition that you don't necessarily, like you said, before you have reached acceptance stage. So you're not sharing it with people. So I don't want every time I'm hanging out with Elsie, she's asking me this and that, the things that seem to be pointing to this condition, and I don't want to talk about it. So it can have you isolated or not want to have conversations. There's also just feeling like you're missing out on life. Especially I think in my 20s, I felt this a lot because you're fatigued, you have these things, and everyone else's life seems to be going on, people seem, so it can affect how you view life and how you relate with people. But again, just going back to the conversations we are having, instead of saying endo is equals to that my personality is changing, talk with a specialist, just have professional help, talk about it, and then you can see how it impacts that. Now, the one thing that I wanted to say finally is even something that Lydia Matthew brought up in terms of all the other things that were happening when you're dealing with endo and when you're dealing with adeno. It's very, very important because to realize that and to be able to take these things apart, because there are times you feel, when you think about anyone who's been on that journey, there are times you felt this burden is too heavy, and yet every month it's the same pain, it's the same, but there are times you felt so. It's important to step back and say, okay, there is also this that is happening in my life, and this and the other. Sometimes it's a bad relationship, honestly. The bad relationship is the one which is making you feel like the endo is much more than it is. Sometimes it's, so it's very, very important to be aware of all these other things that are happening, so that we have the right perspective and energy that we are giving to endo, and not all, because sometimes then it looks like it's a very hopeless and very big and very unsolvable, but we just need to take things apart and see what is within our control, what we can do about the things that are within our control.
I love it. Thank you so much. As I close this session, just so that I can hand over to Lydia to close for us. Thank you, thank you, thank you. Thank you, Lydia. You shared so much. We could resonate with some of it. The loss, maybe not, maybe we do, but you're not alone. And we cannot imagine the pain that you went through, and we appreciate your courage and bravery just to even be able to come onto this stage. Your journey is so valid. Your pain is real. There is nothing that you're imagining. Your your story has so much power, and your lived experience is the thing that will help many women and girls who are out there who are suffering get the right access to care and support. To Faith and to Charles, guys, you guys are, like I said on LinkedIn, you guys are my day ones. Like when we started navigating this journey together, I thank you for your allyship, for you coming, Faith, to share your own personal story, and Charles also just sticking with us. We have so many questions for you, and they will never end. And like I always say to Charles, he's not retiring until we find a solution, until we find a cure. So thank you, everyone. Thank you, Lydia Wahito, for allowing me, and the Echoes of Hope, allowing me to come on here and facilitate and moderate the discussion. It's always my pleasure, and I look forward to seeing you guys next year. We've got such a packed calendar, so I will hand over to Lydia to conclude for us. And it doesn't mean that we're ignoring your questions, guys. By all means, like we sent the questions to the team, and we looked at them, and that's why we curated this specific one, and we will keep doing it into next year. So thank you very much. That's it from me.
So I'd like to reiterate what Elsie has just said. Massive thank you to our very patient and gracious panelists who accepted to just come on this webinar. I think I'm in awe of the generosity this community is giving, just reaching out to the different people, to Dr. Muteshi, to Faith, to Lydia. You've been so gracious to us to just give your time, your energy preparing to come on this webinar, sharing so passionately. We really do appreciate you. Elsie, for just coming through over and over again. Really appreciate you also with the support that you've given this project. Mbarikiwe sana. and may this session continue to assist each and every one of us who are still working on this journey. Thank you to everyone who's made the time to just join in and listen to the panelists, to come and be guided to learn. May we continue to walk this journey together. You can follow us on social media, where we'll continue sharing more information. Even some of the questions that were raised, we'll continue sharing the answers on there. But we also have some upcoming events. We are hoping to have a physical event in January, hopefully the last Saturday of January, where we can meet physically and continue to just encourage one another and learn together and share together. So yeah, that's one of the things that's coming up. And even as we continue with this project, we are shooting portraits and a film on different, like Lydia has shared her story. So we want to continue spreading this word as far as we can to just raise awareness and drive tangible change. We want to see change, guys, so that we don't have to get diagnosis after 7 years, after 10 years. I got my diagnosis after 12 years. So yeah. There are various events by Lost State of Mind, the partner of one of the partners of this project. So you can follow their pages as well, Lost State of Mind, and eventually in March we hope to be able to showcase all the portraits, the film, and the dance by Lost during the Endo Awareness Month. So hope we can keep working together and you can join us through the journey. Thank you so much for everything. And I think we can wrap up unless there's any last comment. Elsie.
I was actually just adding on there that thank you everyone for joining, but I've added the link to our Telegram group where Charles is on there. And it's a peer group where people come, share their own stories, ask the questions, and Charles answers. Sometimes, other people answer on your behalf by sharing their experiences, but also importantly, connecting you to someone who might be around you in your own area or your own vicinity. You might just connect with someone and you might become life buddies, just the same way that, again, this community is not because we knew each other because the disease is the one that brought us together. So please join. Feel free to, when you're on there, just ask questions. And I really thank each one of you for joining. It's been a pleasure, and I really look forward to seeing you guys during the in-person events. And a special shout out. I know my niece is listening on here by proxy. Thank you for Fidelis Wamboy for joining. My sister in love. So yeah, so let's empower the younger girls, the younger generation. Let's make sure that they know that painful period is not normal and that they can raise their voices and we can actually help them, walk the journey. But yeah, that's it for me. Thank you. It's always a pleasure.
Okay. I think I can't thank you enough, guys. I think I'm still in awe of just being able to get such gracious panelists and just committing yourself to this project. And may you be blessed and may we continue to work together as well. And thank you, everyone. We can call it a night.
Happy long weekend. Happy Jamhuri Day.
Enjoy your
Is
Jamhuri
it
Day,
Jamhuri
guys.
Day or not? We
Yes,
don't know
it
what it is called anymore. Is it?
Yes, it is Jamhuri Day.
Thanks, babe.
Okay, so see
Catch
you.
up with you later,
Have a
guys.
lovely
Ciao,
day.
ciao.
Happy
Ciao, bye.
holidays. Bye.
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 Yes.